The Trump administration has officially ended federal emergency abortion requirements for hospitals in a major development with far-reaching consequences for women's healthcare, a move that is already sparking debates and concerns across the country. So what does this mean? Until now, hospitals across the United States were required to provide abortion in emergency situations, even in states where abortion is largely banned. This rule was put in place by the Biden administration in July 2022, shortly after the Supreme Court overturned Roe v. Wade and ended the nationwide right to abortion. The Biden-era guidance was designed to ensure that women facing life-threatening pregnancy complications such as severe bleeding or organ failure could receive emergency abortion care regardless of local state laws. The legal basis for this rule came from a long-standing federal law known as the Emergency Medical Treatment and Labor Act, or EMTALA. EMTALA requires hospitals that receive Medicare funding to provide stabilizing treatment to anyone who comes to the emergency room with a medical crisis. The Biden administration clarified that this included abortion when necessary to save a woman's life or protect her health. Now, with the Trump administration's reversal, that federal guidance has been rescinded. The Centers for Medicare and Medicaid Services announced this week that the previous directive, quote, no longer reflects the policy of the current administration. While the agency says it will continue to enforce EMTALA's general requirements for emergency care, it did not clarify whether it still includes abortion in states with strict bans. What does this mean for women in the United States? The answer is uncertainty. In states with near total abortion bans, doctors and hospitals are now left without clear federal protection if they perform emergency abortions. Abortion rights advocates warn this could lead to dangerous delays or outright denial of care for women experiencing severe pregnancy complications. Is this change a mandate? Technically, no. The Trump administration's move does not create a new law or explicitly prohibit emergency abortions. Instead, it removes the federal guidance that clarified hospitals' obligations, leaving the interpretation of EMTALA up to individual states and hospital systems. The lack of clarity, experts say, could put doctors in a difficult legal position and leave patients at risk. Many physicians say they are afraid to provide abortions even in emergencies because they could face criminal penalties under the state law. Multiple doctors have already faced cases with criminal charges in a nation that has effectively started jailing women for miscarriages in multiple areas and states. This is for sure worrisome. While EMTALA remains in place, the lack of clear guidance on abortion in emergencies could have life or death consequences for women in states with strict abortion bans, and the debate over access to emergency reproductive care is far from over. Reporting from Newsroom, this is Gunjan Handa for The Asian Chronicle.